We're going to look at your infection control management plan in your Smart subscription, and you will find this in the Resources tab in the area of Safety and Quality near the Risks, so around the Risk Register area. And the Infection Control Management Plan is based on a Queensland Health Department template, which has suggestions or guidelines of how practitioners should develop an infection control management plan. So we've brought together resources already available in your Smart subscription, so you can be assured of instantly accessing this particular document. So this is the one from my dental practice, so I thought I'd show you what that consisted of. So we have the references here, and then we have organisational details, and these just come off your organisational profile, and you can click on here and go back and change them all. So we've got the owners of the practice, where it's located, declared health services, which we've put into the profile area, and their Queensland health requirement. Just some basic information goes in there. Then we have our policies and procedures. And in your infection control management plan, these consist of things in your infection control manual from your policy area. And we've picked a primary infection control management plan policy. So it lists the owners of the policy, the date it was accepted, and the review date as suggested by Queensland Health. So you can see all our infection control policies listed there. The next section is the risk analysis and management section, and this comes simply off your risk register, and it consists of examples that are aligned to the National Standard 3, which is the healthcare acquired infection area. So anything that you've listed in your risk register with a 3 action in it will appear in your infection control management plan. So it's simply laid out there. It's quite long. And then we come to staff training, and this lists the very basic requirement for hand hygiene training, which is universal in healthcare, and below that we've got other additional training listed, and I won't show you that because this is actually my practice live, and I haven't asked my staff members whether I can show you. So that's what your infection control management plan looks like, and anyone who's been using the different aspects of Smart Dentist, particularly those undertaking accreditation, will pretty much have that all together. But what I thought we'd do is look at what you see when you initially enroll in Smart Dentist. So if you've enrolled in Smart Dentist simply to be able to say to Queensland Health, here is my infection control management plan, this is what you see. You haven't done absolutely anything in your Smart subscription. This is what you get. So it's a bit empty. So we have templated policies and procedures and risks. So I'll show you the template things that we've got that will help you put together an infection control management plan. You should read about it first and modify your organisational profile so it fits. But we have an infection control manual that will help you put together. So you've only got one document in your infection control manual, and that's your compulsory infection control documents policy, because every dental practice needs that. So let's have a look at what your Smart subscription includes. It includes templated policies, and these are the ones that fit in the infection control area. There are other ones. You can click through there and have a look at other ones. But these are all the infection control policies that are fully written out that you can add to your infection control manual, and you can modify them. So one of them is infection control management plan, and if you click on this little symbol, it just brings it up so you can read it. Same with all of them. So you can just read the content of the policy and decide whether you want to include that in your own manual, and then you just click on add and it adds it in. And I won't do that now, but there's lots of different policies that you would use to build your own infection control manual. And we'll go back to our infection control management plan. So you would add those in, and then you would be able to select one to be your primary infection control manual. The next area is the risk area. So how do you go about developing risks? Again, we have examples. And these are based on information from the Centre for Healthcare Related Infection Surveillance and Prevention, Queensland. They're all very helpful in making sure practitioners can easily become educated in this area. So you would simply click on this risk and add it into your risk register, customizing it, of course, to your practice. And again, it would go on your infection control management plan. And my recommendation, there's 10 listed here that are very specific to your infection control management plan, and it would be normal to actually include every one of those in your plan. So there we go. We've helped you with your infection control manual. We've helped you with your risk register, staff training. If you go to staff training section, you can select a staff member. So you would normally have all your staff members there. You click on that, and we've got a range of training in here that you can simply ask your staff to complete, or you can add your own training in here in your staff training course, or you can list external training. So it wouldn't take you very long to complete an infection control management plan with your Smart subscription.